Welcome to Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black South Florida community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
Good day, everybody. Thank you so much for joining me today. I am Dr. Michelle Kirwan Blythewood. I am a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens, Florida. Welcome back to another episode of Black Health, brought to you by the Health Foundation of South Florida. If you suffer from migraines, you're going to want to join us today for expert tips to find relief and reclaim your life. We are discussing migraines with the migraine expert, Dr. Teshamae Monteith. Dr. Monteith, welcome to Black Health.
Thank you for having me. I'm delighted to be here and to talk about this really ailing condition.
Before we jump into it, tell us a little bit about you, where you trained and what you do.
Yes, I was technically born in New York, but I am a native of South Florida. I did my undergraduate training at Florida International University and my medical school training at University of Miami. And then at some point I said, okay, I do need to venture out. So I did training for neurology at New York University. I did 2 serial headache medicine fellowships because I just couldn't get enough. The first, Thomas Jefferson University in Philadelphia, more of a clinical fellowship, followed by a 2-year research fellowship at UCSF in San Francisco. And then I said, you know what, time to come home. And I am now at University of Miami. I'm the chief of the headache division here. And I am also the program director of the fellowship for headache medicine.
Okay, well, I'm glad you chose to come back to South Florida. We definitely need you here. Let's get into it. What are migraines and how do they differ from regular headaches?
Yeah, so that's a great question. It's important to know that there's kind of the way we characterize headache is in kind of 2 broad categories. A primary headache disorder, migraine is the leading disabling, just in terms of the prevalence out there of this primary headache category. And then there's a secondary category. And as you can imagine, a lot of people come in, they have this new onset headache and they're wondering, do I have a brain tumor? People know about headaches associated with COVID-19 infection. So these are all things that are because of some causative problem, either a virus or infection, sometimes a stroke that can be associated with headache. But by and large, primary headache disorders are sometimes depends on what type of headache disorder it is. Like migraine, for example, is an inherited disorder. And there are many genes that are associated with migraine, or at least the risk of having migraine. So when we think about migraine, it is a leading cause of disability across the globe. We know that in women that are 50 years and younger, it's the number 1 cause of disability. And if you think about everyone, all ages, men and women, then it's number 2. And so it's a really common problem. So we said that it's a primary headache disorder. It's a brain disorder largely. And we said that it's inherited. It's associated with environmental factors, genetic factors, and it's characterized by its symptoms and its clinical presentation. Oftentimes we think of severe pain or moderate to severe pain that lasts hours to even days. It's also associated with certain sensitivities. Some people can be unusually sensitive to noise. So you're telling someone, can you turn it down? It's so loud. And the other person had that volume a week ago and it wasn't loud. There's a perception of loudness. So that's sound sensitivity. There may be light sensitivity. So just regular light, ambient light, like being outside. Computer screens can be bothersome. Smells can be very bothersome. Perfumes, for example. I have patients that they have people that they work with, and no one is allowed to wear a scent. I had one patient in particular that said that everyone knew they were not allowed to wear anything, and the colleague snuck something because they didn't think the patient would notice because it was just like a subtle scent. She tested it out. Why did you test it out on me? I told you no, ever. And, it's a sensory abnormality or perceptual abnormality of routine sensory stimuli. So we said light, sound, smell, touch. Like touch can be bothersome. Your place in space can be bothersome. It's oftentimes a pounding headache. Doesn't have to be on one side, but it's often characterized by that. And there are other associated symptoms with it. Oftentimes people talk about the headache, but there are many other symptoms. There's gastrointestinal symptoms. There's brain fog where you don't think as clearly when you have a migraine. There are other neurologic symptoms that people can have. People that have what we call aura. It's a visual disturbance. People can have flashing lights, zigzags. They can go blind temporarily. They can be weak on one side or even lose speech and have stroke-like symptoms with their migraine attacks. So this is a recurrent neurologic disorder, often characterized by headache, but it's also associated with these other symptoms like gastrointestinal symptoms, the sensory stimuli, or perceptual disturbances of the sensory stimuli, and an array of other symptoms.
Thank you. That was a great introduction to migraines. Are there different types of migraines, or is it just a migraine and different symptoms? Different people have different symptoms in their particular migraines.
Yeah, so there are different subtypes of migraine. We mentioned the aura that people have, and these are transient neurologic symptoms, speech, language, vision is most common, but there are other symptoms that people can experience. So we call that migraine with aura. And many people that have migraine with aura also have migraine without aura. So migraine with and without aura is common. And then people that have migraine very often, these are people with chronic migraine. They're having at least 15 headache days per month. And half of those 15 headache days at least really feel like bad migraines. And that's going on for at least 3 months. Many people that come to see me, they've had it for years at a time. And so chronic migraine is one of the most disabling types of migraine because of the frequency and the severity of the headache and some of the non-headache symptoms that can also be disabling. So you have chronic migraine as well. Some people have what we call menstrual migraine or menstrually related migraine. And that's when you have more headache around the time of your menstrual cycle, the day before or the first day of your menstrual cycle when there's a drop in estrogen levels. And so that is one of the most disabling types of migraine, the ones that are perimenstrual. And so, and then of course, you're a pediatrician. So you know that there's migraine equivalents that people can experience, that before they're having any headache, they can have symptoms of migraine that are non-headaches. We call them like abdominal migraine. They have pain in the stomach. Maybe they're 10 years old and they say, I don't want to go to school. My stomach hurts. And you're like, oh, get to school now. No, like maybe they don't want to go to school, but their stomach may really hurt, especially if mom and dad have migraine. Then their first sign of migraine may present with GI symptoms. And there are a number of other symptoms that may be associated with migraine or may be of migraine biology that are a bit atypical.
What actually happens in the brain when we have a migraine?
Yeah, well, that's a great question. I don't know that anyone has fully sorted out what happens, but we know that the people that have migraine, their brains are wired differently than those that do not have migraine. And it's best to think of when we're thinking about what triggers a migraine, how does migraine start, to recognize that migraine is a multiphasic disorder. So it starts off with a prodromal phase or what we call premonitory phase. And people that are...
Dr. Monteith, let me ask you to put a pin right there. We do need to take a quick commercial break, but as soon as we come back, I want you to go through the different phases. You're watching Black Health, brought to you by the Health Foundation of South Florida, and we will be right back with more on migraines with Dr. Monteith.
Experience the heart of HBCU culture at the Orange Blossom Classic. This Labor Day weekend, Miami Gardens transforms into an HBCU homecoming you don't want to miss. Catch the matchup between North Carolina Central Eagles and the Alabama State Hornets on September 1st at Hard Rock Stadium. But there's more. Enjoy a full lineup of events like the Battle of the Bands and Fan Fest. Tickets start as low as $25. Get your tickets and book your hotels now at orangeblossomclassic.com. Be a part of something unforgettable.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, It's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
There are many ways the cancer journey can make you feel. But when you're surrounded by supportive experts that deeply care, you'll see that this personalized journey wasn't just designed to make you feel better. At Baptist Health Cancer Care, we designed every aspect of it around research to make you feel well. Welcome to Breakthrough Cancer Care.
Welcome back to Black Health, sponsored by the Health Foundation of South Florida. We're speaking with Dr. Teshamae Monteith about migraines. Dr. Monteith, you were just explaining what actually happens in the brain during a migraine.
Yeah. So probably the best way to think about that is to first think about the phases. And if we think about the phases, we can think about the earliest sign of a migraine attack and then what's going on in the brains of individuals that are having these attacks. And so we think of migraine as 4 phases. And of course, there's the interictal phase. The interictal phase is that time when you're migraine free. But people that have migraine, their brains are a bit different. So even though they may not have an active migraine attack, they may be a little bit more vulnerable to sensitivities in the environment. We mentioned smell or light, even if they're not having an active migraine attack. So that's important to know. And then there's that prodromal phase. That's that warning period when a migraine happen. And there are some people that are really good at detecting those symptoms. These are non-headache symptoms. So some examples may be concentration impairment, fatigue, feeling unusually tired. There's some people that start yawning kind of very repetitively. And for them, that or stiffness of their neck. And some people go to the bathroom frequently. And these may all be signs that there's going to be a migraine that's going to happen. And then some people have aura, some people don't have aura. And then there's the headache phase, right? And the headache phase is that period of time where the pain is severe. You could continue to have some of these non-headache symptoms. And then there's the postdromal phase, and that's when the headache is gone, but you feel kind of hungover, very tired. I know our listeners, some of them are going to be like, yes, I get that. I know exactly what that feels like. And so if we think about the prodromal phase or the premonitory phase, there's a lot of things that we think are going on in the brain. We think the earliest signs of a migraine attack is in the structure of the brain called the hypothalamus. And the hypothalamus is important for homeostasis. And so that is kind of generally being well. And so you can imagine if you have poor sleep, if you have a lot of stress, the hypothalamus partly regulates some of these systems. And so you can see how that could tip over a migraine attack. And there is the trigeminal vascular system. The trigeminal nerve is the nerve that senses pain of the face, right, and head. And so there's an activation of that system that happens, and it happens whether there's a stimulus or not. It's kind of spontaneously happens. And that activation of that system, that trigeminal vascular system, is associated with release of certain chemicals, neurochemicals, neurotransmitters, neuropeptides. One particular peptide that people are very interested in is one called calcitonin gene-related peptide, also known as CGRP, because that's now one of the important targets for a lot of these newer medications that are now available. And so, so you have a lot that's going on in terms of release of these neurochemicals. There is sensitization of the brain that's happening. And so people, again, have the sensitivity of light. They have the sensitivity of sound. There may be activation of emotional centers. So people may be more irritable. People say, of course I'm irritable. I'm having a severe headache. What are you talking about? Anyone would be irritable. But that is on a level of the brain and not necessarily on a level of I'm experiencing pain, I'm upset. Yeah, might be the case, but your brain is more likely to um, perceive kind of sensitivity to even emotional input. And that's all on the kind of the brain level, the neuronal level. It's very interesting, all of these changes that are happening. It's also a lower threshold to have migraine attacks. So when people have their menstrual cycle, they're having a migraine attack, probably not a good time to drink red wine because you're already lower
Mhm.
threshold, right? So we do our best to manage or triggers as much as we can.
Is there a link between mental health disorders like depression and anxiety and migraines?
Yes, there's a very strong link, and we call it a bidirectional link. So people that have anxiety and depression, if you follow them later in life, they're more likely to have migraine later in life. And the same goes if you start off with migraine, you're more likely to have late onset anxiety or depression. And so there's probably some shared biology that is associated with these types of disorders. In addition to shared biology, there are probably other environmental factors as well.
How are migraines diagnosed?
Yeah. So migraines are diagnosed clinically by the symptoms that people describe, and many people can it's in the lay audience, when people have migraines, similar to depression in some ways. But it's important to understand the diagnosis because it's so underdiagnosed. And I think in particular in African American and Hispanic communities, migraine is underdiagnosed. So the symptoms that I mentioned is the best way to really diagnose migraine. Of course, it's good to have a neurologic examination and a general examination. Make sure that there's nothing else that we call these red flags that would suggest secondary cause of headache
Mhm.
that might be mimicking migraine. So, in the setting of a normal neurologic examination, a normal general examination, and no of these kind of red flags that, for example, prolonged weakness, loss of speech for a very long time, loss of balance, that would be concerning that there may be something going on that we need to maybe order some imaging and make sure that there's nothing else. But aside from those red flags, it's really based on history and the absence of anything abnormal on your neurologic exam. These are uh, neuromodulation. There's about 5 of them that are FDA cleared. These are non invasive devices that can be used to treat acutely as well as preventively for treatment of migraine. So there are a number of things that can be used in terms of non-pharmacological things. There are also supplements and vitamins that are available, oral magnesium, vitamin B2 or riboflavin that can be helpful. There are a number of others that are available to people that are interested in that kind of approach. From the pharmacologic perspective, most patients should have at least some acute treatment available. That can be severe and very disabling. There are things that are over the counter, like ibuprofen. There are things like naproxen that can be used. That acetaminophen can be helpful for some people, but oftentimes are not enough. And then the combination therapies that include things like caffeine that might be helpful for acute treatment. So those things you can get over the counter. But when you see a neurologist and you're having a recurrent migraine attacks that are disabling, affecting your quality of life, your ability to function in school or work, you may need a prescription therapy. So, in terms of the acute treatments, there are things like triptans, and these are drugs that target chemical called serotonin.
Mhm.
So, it's a serotonin agonist. And so there are 7 triptans that are available. They come in pills most commonly, but melts in the mouth, injections, and nasal sprays. There are some newer treatments that are available. These are called the GPANs. We talked about CGRP earlier. So this drug targets the receptor that CGRP has to bind to a receptor. So it blocks the receptor, so CGRP can't get to it and signal pain. So there are now 3 of these GPANs that are available, and these are very safe treatments. They're nice because they don't cause or they're not vasoconstrictors, so they don't
Mhm.
air blood vessels, which may be important for people that have a history of heart attacks or even strokes in the past. So the G pants are a nice addition as well.
Dr. Monteith, sorry to cut you off again. We do need to take another quick commercial break and pay a few bills. Black Health brought to you by the Health Foundation of South Florida. We'll be right back.
Experience the heart of HBCU culture at the Orange Blossom Classic. This Labor Day weekend, Miami Gardens transforms into an HBCU homecoming you don't want to miss. Catch the matchup between North Carolina Central Eagles and the Alabama State Hornets on September 1st at Hard Rock Stadium. But there's more. Enjoy a full lineup of events like the Battle of the Bands and Fan Fest. Tickets start as low as $25. Get your tickets and book your hotels now at orangeblossomclassic.com. Be a part of something unforgettable.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman and Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
There are many ways the cancer journey can make you feel. But when you're surrounded by supportive experts that deeply care, you'll see that this personalized journey wasn't just designed to make you feel better. At Baptist Health Cancer Care, we designed every aspect of it around research to make you feel well. Welcome to Breakthrough Cancer Care.
Welcome back to Black Health. If you're just tuning in, we are talking about migraines with Dr. Monteith. Dr. Monteith, tell us a little bit about the impact of migraines on your patients' work, their education, their family life, their daily life.
Yeah, that's so important because it's a recurrent disorder and it's oftentimes unpredictable. It affects people in different ways. Some of that affect maybe even just trying to prevent a migraine. There are people that don't want to go out in the sun. They don't want to go in large crowds, and maybe their family's going there, or maybe because of work, they have to avoid certain exposures, whether it's sound, repetitive noise, or fluorescent lights. So these things can impact people's quality of life and sometimes requires accommodations. It can be very lonely having migraine because you're in a room, sometimes you're in a dark room, you're by yourself. And even if the person you're talking to also has migraine, they may not have it to the extent that you do, and may not fully understand what you're going through and why you have to separate yourself. So between the symptoms that people have, the emotional impact, the isolation, but also there's a economic injustice that also occurs because, as you can imagine, it's a leading cause of work disability and absenteeism. And for people that have very frequent migraines or children that have very frequent migraines, over time, that has an impact.
Mhm. I'm glad you said that. My next question was actually if there are any specific socioeconomic factors that actually exacerbate migraines in frequency or severity, and maybe looking more so at the Black community.
Yeah, well, education is an important factor. So not graduating from high school, being underinsured is also an issue, especially in terms of access to some of the better treatments that are available. Uh, uh, Marital status, so going through a traumatic divorce or a traumatic life event, can will be stressful. And there's been some research looking at the role of discrimination and stigma and how that may come into play in someone's migraine journey or experience.
So we only have about a minute left. Just for somebody who's watching that has migraines and they're wondering, can I be helped? Do you see that all the treatments that you named, are they effective? And should somebody be able to really reduce or eliminate maybe their migraines if they're working with a neurologist and following the plan?
Yeah, one of the main reasons I got into this field was because it was such a wonderful opportunity to really modify people's well-being. And it is one of those disorders that you can really make a lot of advances and improve quality of life. We spoke about the acute treatments, but there are also pharmacological preventive treatments that are available, new ones. And so between the pharmacological treatments and the list of other possibilities, it's really important to first get that diagnosis and then get on a good treatment plan.
So there is hope, is what you're saying.
Absolutely. I think your listeners should go on to the American Migraine Foundation, where there's a lot of information where they can read up about migraine and some of the latest treatments that are available.
And if they want to come and see you, how do they find you?
They just call up University of Miami. I'm available and happy. We have a whole team of people that are happy to see you.
Great. Thank you so much, Dr. Monteith, for your time and your expertise. We appreciate you taking time out of your day to join us on Black Health and help educate our community.
Well, thank you for doing this. I really appreciate that.
Absolutely. And for those that are watching, thank you for joining another episode of Black Health. We are brought to you by the Health Foundation of South Florida. So thank you to Health Foundation. And if you would like, you can follow me on IG at Black Health Show. We will see you on the next episode of Black Health. Until then, be well.